Okay. Hi, everyone. I'm Cindy Perlin. I'm the founder and CEO of the Alternative Pain Treatment Directory. And with me is my magnificent assistant, Charlena Green. She'll be monitoring the chat and posting links and doing things like that as we go along, monitoring any questions. So this is the webinar on natural drug-free pain relief. Why do natural is part of it. So I'm going to spend a little bit of time talking about what's wrong with conventional pain treatment. And then it's a very brief overview of the vast array of different natural pain relief treatments that are out there. Just let me say a little bit more about my background. I'm a clinical social worker and I'm a chronic pain survivor. Over 40 years ago, I hurt my back and I was completely disabled and in agony 24/7 for 3.5 years. And conventional medicine was absolutely useless. And that's when I started looking for my own solutions, doing my own research, which has become kind of a dirty word in some circles over the last few years. But I strongly encourage everybody to do their own research when it comes to these treatments and any other medical treatments that you're thinking of trying. So pain is a very complex problem with many causes, and there's no one-size-fits-all pain treatment. If you ever see a provider that says, I have the answer, run away because nobody has all the answers. There's many treatments that can help and can even cure. If you look at some of the inspiring stories on the Alternative Pain Treatment Directory, you'll see the latest one is a woman who was in pain for 79 years before she found an answer. And that's probably longer than is common. Some people never find an answer. I have some news stories I'll be posting about a woman who is finally free of fibromyalgia after 46 years, and a man who was debilitated by chronic pain all over his body for more than 30 years and now runs ultra marathons. So there's hope out there. There's lots of treatments, and most are being ignored by conventional medicine. Causes of chronic pain that are commonly ignored by conventional medicine, and these include nutritional deficiencies or inflammatory diets. Your diet and affects every single cell in your body. Your cells make up your organs. The nutrition is important for hormones and neurotransmitters and everything else that goes on in your body. Another common cause is soft tissue imbalances. If your muscles are out of balance, if one muscle is tight and an opposing muscle is too weak, that can cause chronic pain. If you've compensated for an injury and walked funny, which happened to me at one point, then using your foot normally can become impossible, or using, your limbs normally can become impossible. Weak or stiff muscles, which can be from lack of exercise, lack of movement, trigger points that can come from overextension injuries or chronic stress or trauma, muscle spasms, which can be from nutritional deficiencies or just chronic tension. Chronic stress is another cause that's commonly ignored by conventional medicine. Unresolved trauma, which can have a profound impact on every system in your body, particularly your brain and nervous system. And toxicities or allergies can be another cause of chronic pain that's ignored by conventional medicine. So conventional medicine focuses exclusively on external manipulation of the body while ignoring both the causes of pain and the body's own healing capacity. Focuses on pharmaceutical treatments, injections, surgical treatments, surgically implanted devices, basically, hitting everything with a hammer when it may just need a little nudge. So the most common treatment, opioids, have a very low effectiveness and a high risk of side effects. And here's just a list of some of the common opioids that people are prescribed. Despite the hype that opioids are, the best that we have and they're powerful pain relievers, they actually, according to research, provide only a small reduction in pain compared to placebo. And they don't work for more than 50% of the people that they're prescribed for. Less than 50% of the patients either get any pain relief or can tolerate side effects, which can be drowsiness, nausea, vomiting, dizziness, constipation, physical dependency, and of course, worst case scenario, overdose and death. Also, opioids have no evidence of long-term effect in chronic pain. The studies that have been done on long-term chronic pain use, opioid users who have chronic pain compared to people who have chronic pain long-term and don't use opioids, show that the people of opioids have worse outcomes. They're in more pain and they have lower function, lower productivity than people who don't take opioids chronically. Everybody talks about addiction and overdose when it comes to opioids. The pharmaceutical companies put out false information early on that said that less than 1% of the people exposed to opioids develop an addiction. And actually, the best research to date says that 10 to 12% of patients get addicted to opioids. But that's not the only problem. Opioids, because of the sedatory effect, they contribute to 23% of fatal auto accidents. So they pose a risk not only to the user, but to other people around them. Opioids also decrease your immune response, increasing the risk of infections and cancer. One study indicated that there's a 64% increase in all-cause mortality within 6 months of starting opioids. And if you're pregnant and you take opioids, it could be a danger to your unborn child. 14% of pregnant women take opioids at some point during their pregnancy. And if their use is chronic, their babies go through opioid withdrawal after birth. And it can really affect the nervous system of the child long term. You can make your own opioids, and I don't mean in a lab. Your body naturally makes opioids. They're called endorphins, and they're a natural opioid. They're the first neurotransmitter that was ever discovered. And they were discovered by Candace Pert, who was a scientist, a neuroscientist. And she hypothesized that if opioids attach to receptors in the body, in the brain, then there must be a natural substance that also attached to those receptors. And that's when endorphins were discovered. And your body naturally makes endorphins all the time, but there are things that help your body make endorphins. For instance, when you laugh and when you exercise. One of my first exposures to mind-body healing was a book by Norman Cousins, who suffered from a crippling joint disease that was progressive. And he discovered that the more he laughed, the better he felt and the less pain he had. And eventually the science caught up with him, and they found that the more you laugh, the more opioids your body produces, natural ones. And when you take prescription opioids, your body stops making as many natural opioids. And that's why when people try to withdraw from opioids, they have such a hard time. That's not the only drug that there's a problem with if you use them long-term for chronic pain. NSAIDs like ibuprofen increase the risk of heart attacks and strokes, kidney damage, and GI bleeding. And GI bleeding can actually be fatal if it goes on long enough undetected. Gabapentinoids are another class of drugs that are used more and more as conventional medicine tries to move away from opioids, but stays at looking at drugs for a solution. Gabapentinoids help very few people. Only 23% of the people who prescribe them say they help. The rest of them say they're poison, don't ever take them. They'd never take them again. Some of the side effects include suicidal thoughts, addiction, overdose, memory problems, increased risk of dementia, and yet they're the fifth most prescribed drug in the United States last year. Acetaminophen, otherwise known as Tylenol, is connected to liver failure if you overdose, and liver failure is fatal without a liver transplant. Steroids are another drug that's commonly used, and they decrease immunity, cause bone fractures and muscle weakness. And immunosuppressive drugs, which are often used for rheumatoid arthritis and other autoimmune diseases, increase your risk of infection because they suppress your immune system. It says so right in the name. Rescue medications for migraines can cause medication overdose headaches, leading to chronic daily headaches. So they can also make things worse in the long run. If you're going to take a drug, which one do you think is better? Opioids or marijuana? I'd say marijuana. So here are the facts about marijuana. Marijuana has been used medicinally for at least 10,000 years. There's not one documented death from overdose from using marijuana, while there have been over 1 million deaths from opioid overdose in the United States since the late 1990s. According to patient surveys, marijuana is effective for pain relief in 90 to 95% of users, compared to less than 50% of opioid users. Marijuana has fewer side effects than opioids. Marijuana is anti-carcinogenic, where opioids lower immunity and increase your risk of infections and cancer. Marijuana is neuroprotective in older people, according to recent studies. Talking about seniors, but if you're a young person, if your brain is still developing, which happens until you're about 26, marijuana, in terms of chronic use, can negatively affect brain development. So young people need to be careful. Opioids increase the risk of dementia. Of course, the conventional medical community, including the FDA and the DEA, would like you to think that marijuana is not as effective as opioids. But the reality is that that advice is heavily influenced by the pharmaceutical companies who give the FDA a lot of money. Surgical treatments are often based on false premises and they're risky. Most people don't know that unlike drugs, which they at least make an attempt to make sure they work before they get out on the market, surgical treatments don't have to show any evidence of safety and effectiveness before being widely used. A surgeon decides to try something, he likes the result that he gets on a few patients, he presents at a conference or writes a journal article, and all of a sudden everybody's doing these surgeries, even though they don't really have any hard statistical evidence that that the procedures are effective and that they're safe. And many procedures are in long-term use before they're ever found to be useless or worse. A lot of people get MRIs, particularly when they have back pain, and they get diagnosed with disc disease. And then that's used as a basis for recommending surgery. But in fact, almost everyone has disc disease in terms of herniated disc, degenerative discs, bulging discs. And the older you get, the more likely you are to have so-called disc disease. But they've known since the 1990s from doing MRIs on healthy people that you can have bad discs and have absolutely no pain. So a lot of experts have concluded from that that it could be that that MRI that shows that disc disease that may have nothing to do with your pain. It may just be coincidental that you have that, and it's some other cause, usually muscle issues that are causing the pain, and not a disc problem. Failed back surgery syndrome, where pain persists after surgery, is very common, and it's highest for lumbar fusion surgery at about 46%. And if you have a surgery and it doesn't work, or you have a surgery and it seems to work, but you have problems later, and another surgery is done, the more surgeries you have, the less likely the surgery is going to have a good outcome. And there are lots of studies that show that non-surgical management of pain often works as well as surgical interventions, particularly over the long run. Most people know about the placebo effect in drugs, that if you take a drug, just your expectation that's going to help can cause a positive effect. And what they found, and they call that the placebo effect. What they found with placebo effect is that the worse the treatment is, the more likely there'll be a placebo effect, because the person's mind has to justify going through, for instance, a back surgery to justify it. So the brain makes the person feel better, even though maybe the surgery itself or the drug itself didn't have that much of an effect. And surgery can worsen a patient's condition by creating structural instability or misalignment, causing injuring nerve roots, creating scar tissue, causing wound infection. And as I mentioned earlier, the more back surgeries a patient has, the less likely they are to be successful. One of the things that happens when you fuse a vertebrae is that the rest of the spine has to take on all of the work, and that can cause problems down the road, even if it doesn't cause problems right away. And studies have shown that there's a high correlation between unsuccessful spinal surgery and a history of childhood trauma. The more types of childhood trauma someone has, and that could be physical, sexual, or emotional abuse, neglect, domestic violence, alcoholic parent, mentally ill parent, the more of those you've had in your childhood, the less likely spinal surgery will be effective. It gets so bad that if you have all of those, the chances of having a successful back surgery is 0%. So when surgery fails, a spinal cord stimulator is often recommended. This is a surgically implanted device that sends an electrical signal into the spinal cord in order to reduce your perception of pain. And studies have shown there's no long-term reduction in use of opioids, pain injections, or subsequent surgeries. And these devices often go bad. They move around, they stop working, the batteries go dead. Up to 40% of patients experience complications, and half of those require removal of the device, which can be dangerous. Now that I've hopefully thoroughly warned you of every conventional treatment that there is, I'm going to talk about different options for natural pain relief. And none of the therapies that I'm going to talk about have serious side effects. None of them will cause permanent injury or death, or in many cases, even mild discomfort. So I'm going to start with talking about body-based therapies. For instance, physical therapy and chiropractic are proven treatments for chronic pain. And over the years, thanks to managed care, access to therapies like chiropractic and physical therapy have gone down. There's treatment limitations. The payments for treatment to providers has not kept up with the pace of inflation. In fact, even worse than that, when managed care came in, they lowered fees for everybody. And then for the most part for these therapies, they haven't raised them in over 40 years. So it's been difficult for providers to stay in business. When they do, they spend less and less time with patients. And during the time that this has been happening and people have had less access to these treatments, more and more people, the prevalence of chronic pain has gone up. Chiropractic treatment was libeled, a court had found, by the medical profession, particularly the AMA, who said they were quacks, they would hurt you, they don't know what they're doing, don't go. In fact, chiropractic treatment around the world is accepted as an effective treatment by more than 70 world governments and the World Health Organization. And of those governments that say it's effective, that includes the United States. Not every chiropractor, not every physical therapist is the same. Some are much more talented and effective and compassionate than others. So if you tried it before and didn't get the results that you'd hoped, that doesn't mean that that therapy is not going to be effective for you. You possibly have not found the right provider. Exercise is critical for pain relief because most pain is actually muscle generated. Muscle stiffness, weakness, spasm, imbalances, and trigger points can all contribute to chronic pain, as I've said earlier. That doesn't mean that you have to be out running a marathon, but one of the worst things you can do for chronic pain is to stay in bed. At one point in my chronic pain journey with my back, I was told to stay in bed until I felt better. And I felt worse and worse and got more and more depressed as time went on. I didn't feel any better. And by the time another provider told me to get out of bed, I was so weak I could barely walk around the block. That is not helpful. And what happens too with people is they become afraid to move. It's called kinesiophobia, fear of movement. And that's because a lot of times when people in chronic pain, they conclude or they're told that their body is broken, and then they become afraid to use it. And that's very counterproductive. There's a lot of exercise programs out there that are guided. One of them that doesn't exist anymore was very helpful to me in my recovery. It was called the Wise Way to a Healthy Back. And it was a 6-week program, twice a week, where you went in and you did supervised movements and stretches. And it got me back to being able to exercise again and being able to trust my body again. So another really useful therapy, especially because so much of chronic pain is related to muscles, is massage. And there's evidence showing that 10 weekly massage therapy sessions can provide long-term relief. Some people go once or twice and they see that the effect doesn't last, which it won't when you first start getting massage therapy. But if you go to someone who does a type of deep tissue massage, like myofascial release or trigger point release or Rolfing, those are all massage therapy techniques that if you stick with them with a good provider over 10 weeks, they've shown can provide lasting pain relief. They can actually rebalance your muscles, stretch them out, and correct some of the underlying problems that are contributing to pain. As I talked about a little bit earlier, nutrition is critical to healthy cells, tissues, and organs. Every part of your body is made up of cells, and cells need nutrition. And this includes eating the good stuff. And we probably all know what the good stuff is: fruits, vegetables, fatty fish, healthy fats, nuts, olive oil. That also includes staying away from the bad stuff, which is sugar, refined carbohydrates, processed foods, trans fats. Not only helps with pain, but overall health. And herbs are often as effective or more effective than pharmaceuticals, but they're largely ignored by conventional medicine. They can't be patented. You can't make a lot of money. So the pharmaceutical companies would rather you ignore them. Two herbs that are especially worth noting. One of them is kratom. A lot of people have not heard of kratom. Some people have heard bad things about kratom. Kratom is a Southeast Asian herb. It's grown mostly in Indonesia, and it provides pain relief for more than 90% of pain patients with far fewer side effects than opioids. Now, the FDA has had a vendetta against kratom. They've tried to tell people that it'll kill you. They point to a couple of dozen deaths over a period of 5 years of people who had multiple substances in their system when they died, including other drugs that could have caused a fatality. Or in one case, a few people died of contaminated kratom that had substances that were dangerous in addition to the kratom. So, a few dozen deaths is less than happens in one day with the use of opioids. The FDA has been so vehement about this that 5 states have banned the use of kratom. Other states, with the help of the American Kratom Association, which is an advocacy organization, have put in place laws that regulate kratom to make sure that it follows good manufacturing practices, is free of contamination, and has the amount that it says in it, and also is only sold to people over 21. Kratom is mildly addictive. Withdrawal does not seem to be a big deal. Withdrawal will not kill you. Experts say that it's about as addictive as caffeine. There are people in rehab who say that they're addicted to kratom. So, it is a little bit controversial, but nowhere near as dangerous as opioids, and nowhere and much more effective than opioids as far as all the reporting is concerned. One of the organizations doing research on it is Johns Hopkins. Another one is the National Institute of Drug Abuse, whose pronouncements about kratom directly contradict what the FDA is saying about kratom. And it's important to understand, as I said earlier, the FDA gets a lot of its funding from pharmaceutical companies, and their interest seems to be more in protecting the profits of the pharmaceutical companies than protecting the public. So that's my opinion on it, which I think is well supported. On the alternative pain treatment directory, there's quite a lot of information about kratom. There's also a few kratom vendors. The American Kratom Association has their own certification for kratom, and they have vendors that they've certified as having standardized kratom free of contamination using good manufacturing practices. So you can go there and find out who are the vendors that are safe to order from, and you can order online. And as I mentioned, there's a few on my website that I recommend that are also vetted by the American Kratom Association. Another powerful herb is turmeric. It's an herb that gives curry its yellow color, and it has powerful anti-inflammatory effects. It's a very good herb to take if you've got pain and inflammation. It's also immune boosting and has many other positive effects. You can get turmeric in capsule form. Its active ingredient is curcumin, which you might see the ingredient or the herb sold is curcumin as opposed to turmeric. But it's again a very good herb. And there's many, many others. I have many listed on my website. If you look for herbal treatments on my website. But I think there's a book that's equivalent to the PDR for pharmaceutical drugs. There's one for herbs, and it lists, I believe, 110 herbs that are useful for pain relief. Obviously, I don't have time to review all of them here, but they're out there. Another therapy that's natural and is one of my favorites, and is getting a lot of attention more recently, it's light therapy, particularly red light therapy, and infrared light therapy. And what they found is that it has a healing and anti-inflammatory effect on tissue. You have to use it right against your skin, and the light penetrates your cells. And what it does is it changes the permeability of your cells so that your cell walls emit more oxygen, more nutrition. Your cells create more cellular energy. Your cells are more able to reduce and release toxins. And so basically it accelerates healing while reducing pain and inflammation. And there are many home use devices. One of them is the photo on the left. It's the DNA Vibe, and it costs about $270, and you can use it again and again. I've had mine for years. It's great for if you have local pain. There's also light therapy devices. I have another one. I'm so fortunate. I have all these home use devices that I use with my clients too. I have one that's like a sleeping bag that you get in, and it treats your whole body. It's got the lights, throughout the pod that you get into, and it zips up just like a sleeping bag. So there are panels that you can stand in front of that do the same thing. And this is something that's come into use over the last 40 or so years. If you were to go to a clinic that offers light therapy, you will see something more like the photo on the right. And it's a more concentrated light. It might be a laser device, and laser is light. And when it's red laser, it does the same thing that I was just talking about. Laser as opposed to LED devices. Home use devices tend to be LED devices. Laser theoretically penetrates deeper into the body. And also the clinical devices are more powerful. So you might use them for a minute per area, as opposed to the DNA Vibe you might use for 30 minutes, wrapped around your sore knee or your shoulder that hurts or your sprained ankle or whatever. But with home use, it doesn't matter that it takes a while. You can use it in bed or while you're watching TV or doing your work. The DNA Vibe has some other therapeutic values, which I'll talk about in a few minutes. So another, and this is even newer than light therapy, is vagus nerve stimulation, especially non-invasive vagus nerve stimulation. The vagus nerve is a long nerve that goes from your brain stem throughout most of your body, your torso, your arms. And what it does is it calms your nervous system. So your sympathetic nervous system revs you up to prepare for fight or flight when you're under stress. And the vagus nerve stimulates the parasympathetic, which is what they call the relax and digest nervous system. So at first, when they wanted to stimulate the vagus nerve, they did it with a brain implant. Um, and that, of course, was expensive and risky, and they liked it because it was expensive. But it's been discovered that if you stimulate an area of the body that is where the vagus nerve is close to the surface, and that's particularly your neck, that it can trigger your vagus nerve to relax the body. And the device that you see the woman in the picture wearing around her neck is called the Pulsetto. And you wear it for the stress setting is 4 minutes, the pain setting is 20 minutes. There's a burnout setting, a sleep setting, and you just wear it around your neck. You use a little gel. It works with your cell phone, and you turn it on. You can be doing other things, or you can be relaxing, and it just calms your nervous system, and it helps with pain. I've had mine for about 8 months, and it's just been so wonderful. I have clients who use it. It's been really helpful for them. It's a device that costs about $250 and will probably last you for years. And again, a very natural way to relax, can not only help you reduce pain medication, anxiety medication, sleep medication, migraine medication. It can help you reduce or eliminate all of that just with a little bit of gentle vagus nerve stimulation. Another therapy that you can get a home use device for or have at a clinic, which would be a more powerful device, is something called frequency specific microcurrent. So every part of our body has electrical activity, different frequencies in the body, and they're very low level frequencies. They're not like the electrical appliances you have in your house. They're very subtle electrical frequencies. Your body works on them. Different cells and different systems operate at different frequencies. And a frequency specific microcurrent targets different frequencies depending on what you're trying to do, what part of your body or what problem you're trying to resolve. And it stimulates your body to reduce stress and pain and accelerate healing. And it's just, it works again with your cell phone. That square thing that's in front of the, sort of a square thing that's in front of the cell phone in the picture, it weighs about an ounce. It's very tiny. You plug in some cables that are connected to either a wristband or you attach to disposable electrodes, and you put it on the part of the body that you're working with. If it's your whole system you're working with, you use the wristband or use electrodes on your wrist, and it helps your body to rebalance and heal in that way. Another one, and I just love all these devices. I
Hey,
have every one
Cindy.
of them. Yes.
Hey, we have two questions from Joy.
Okay.
And I don't know, you want them now or?
If they're related to what I'm talking about now, sure.
Well, yeah, she was just saying that physical therapists and chiropractors made her pain issues worse. Um, she said she just needs to know your suggestion on what helps.
It's a little hard to say without knowing anything about you. Um, all of this stuff is potentially helpful, depending on your condition, your history. Some of it will be more helpful than others. So hold your question till the end. Um, see which of the things I'm talking about, you know, you have a gut feeling about, and maybe, mention a few things about what's going on with you. The idea that chiropractors and physical therapists made you worse, that certainly is possible if you have people who, they just do the same thing for everybody. Physical therapists can push you too hard. The therapist that I broke my ankle 6 years ago. And had to have surgery. And I went through 4 physical therapists before I found one that worked. And the ones I didn't like were the ones who said, do this exercise, I'll be back later. Do that exercise, I'll be back later. The one I really liked was actually hands-on. They did manual manipulation. They did frequency-specific microcurrent. They spent a lot of time with me. And that was very helpful. Out of the 4, they were the most helpful. Not that exercise can't be useful, but physical therapy should be more than that and should be, individualized depending on what's going on with you, and should be about listening to your body and what feedback it's giving you about what's going on. Chiropractors can also be too aggressive. So, I would say maybe you didn't find the right one. And, it would be good to keep looking. Not that that's easy financially sometimes, but they may not be what you need. So I'll just forward John, and at the end we can talk more about that. So pulsed electromagnetic frequency therapy is another effective and non-invasive option. Your body is also a magnetic system, and there are electromagnetic fields in the environment that are not good for us, like those that are emitted by power lines and cell phone towers and things like that. Our electronic devices, our wireless devices, give off electronic fields that are not good for us. They're too powerful. They're too overwhelming to our system. There are people who are very, very sensitive to these things. Most people don't notice on a day-to-day basis that their systems are responding to these things. But pulse electromagnetic frequency therapy is, again, very, very light touch, very low frequency fields that are things that are endemic to the body, frequencies that the body produces on its own when it's healthy. And by stimulating the body with healing electromagnetic frequencies, that can reduce pain and inflammation and accelerate healing, just like the light therapy. So the DNA vibe that I showed you when we were talking about light therapy, that also does the PEMF therapy. You get both of them in one. You also get vibration, which stimulates healing too by, encouraging circulation. So there's also the device that you see in the picture, and I have one of these too. It's got 59 different protocols, depending on what's going on with you, for sleep, for pain, for fibromyalgia. I'm getting over a cold. I discovered that it had a setting for common cold. And I think that I recovered from my cold much more quickly using the device. I can't swear to it. I always do extra supplements and things like that, but I'm remarkably better considering where I was 2 days ago. I thought about canceling this or rescheduling it because I was feeling so crappy 2 days ago, and I'm getting pretty close to normal already. So I do think that this helped. It's even got a setting for acne. And by the way, the light therapy is very good for your skin, for reducing aging, clearing up acne, whatever. So there's all sorts of side effects of these therapies that are good. So I'm a big fan, as you can tell. This is another device. It's a neuromuscular electrical stimulation device. This particular one is called NeuroMD, and you're seeing their first device here, which was specifically for back pain. They have this nice electrode pad that's like a butterfly bandage kind of thing that goes on your back. And what it does is it stimulates the muscle so that it contracts and relaxes, contracts and relaxes. And what that does is it strengthens the muscle, it improves endurance, it helps with recovery in patients that have neuromuscular impairments, it reduces chronic pain, it improves mobility, and it's a very non-invasive targeted therapy. They now have different configurations of their device for other parts of the body so that you can use it on any other part of the body. They now have one that's a foot pad that you can use on your feet. The whole pad is stimulating, and you have a little device like the one in the picture, but it plugs into a pad and you put your feet on it. And I've been using that. It's good for neuropathy and other kinds of foot issues. I don't have neuropathy, but what I do have is chronically tense feet. I have hammer toes, and I've had all sorts of foot injuries, and I've been putting my feet on this device and it relaxes them, and my toes are starting to uncurl. So, it's good for things like that, particular tendency of mine has created a lot of foot problems, and this therapy seems to be healing them. So, another thing that whether you've got back pain, neck pain, arm pain, this can be very useful. Now, this is a therapy that you have to find a practitioner who offers it. This is CalMare Scrambler therapy, and you can see a picture of the device in the photo. What it is it's for neuropathy, and what it does is it scrambles the brain's pain signal so that it stops sending it. It does that by sending what they call a no pain signal to the brain. It's done over a period of an average of 10 sessions. And at the end of an average of 10 sessions, most people with peripheral neuropathy, with complex regional pain syndrome, with fibromyalgia, with chronic migraines, phantom limb pain, they're in significantly less pain, or sometimes they're out of pain. And sometimes it takes a few more sessions, sometimes it takes a few less, but it's based on the fact that oftentimes the brain will just get stuck in pain. It's part of the body's protecting you by alerting you there may be danger and to protect the damaged part, but it doesn't shut down when it's supposed to, when that's healed. And so sometimes people need boosters. This therapy is not cheap. It costs an average of $250 a session or so, 10 sessions, not covered by insurance, of course not. Not readily available. The provider in this picture, who's listed on my website, he's in New Jersey. He sees people from all over the world. People fly in from other countries to be treated by him. There aren't a lot of these devices around. There's one in my area, in the Albany, New York area. Laura Brown, she's another provider on my website. There's people in Florida, California. There's a guy in Buffalo, New York. There aren't a ton of people around, but if you can access this therapy and you have neuropathy, you may find that it's very effective. Another thing that's good about it is that you can find out very quickly whether it's going to work or not for you, because the pain doesn't at least briefly stop within the first session or two when you're doing the treatment. It's not going to work for you. So you don't have to go through the whole course and find out, it failed you. If it's going to work for you, you'll get an indication early on. So there's other energy-based therapies that also have evidence of safety and effectiveness. Um, Acupuncture, and again, it does matter which acupuncturist you go to. Some are better than others. There's actually a study of emergency room, um, in an emergency room comparing acupuncture to morphine for people who came into an emergency room with acute pain. And they found that acupuncture had fewer side effects, worked more quickly, and eliminated pain more completely than morphine. There's studies of chronic pain that show that, there's all sorts of studies, particularly low back pain. There's so much evidence of acupuncture being effective for low back pain that Medicare has actually started paying for it. So, the evidence is growing. One of the things that is one of my pet peeves is that acupuncture has been used for thousands of years all over Asia, and it spread and continued to be used because it worked. And bring it to the United States or, one of the Western pharmaceutical dominated countries, and they have to test it to make sure that it works. And of course, there's no money to test it because studies are very expensive, and individual acupuncturists don't have that kind of money to devote to it. So, there's not as much evidence, they say, but the evidence is that to me, is that it's been in use for thousands of years, and people find that it's effective. It came to the United States in, I think it was during Ronald Reagan's term. So it was 1980s. And was it? I think it was, yeah. No, I think he was still governor of California at the time. But a New York Times reporter was reporting in China, and he had acute appendicitis and had to have surgery. And after the surgery, he was treated with acupuncture for pain. And he was so impressed by the results that he came home and wrote an article for the New York Times about acupuncture. And that was the introduction of acupuncture in the United States. For many years, it was illegal in the United States, but now it's legal everywhere in the United States. And you not only find Asian practitioners, you find, Caucasian practitioners who've gone to acupuncture school. And a lot of people find that it's really helpful. And evidence is growing, as I said. Another energy-based therapy is energy healing, hands-on healing. And this may be a surprise to some people, but I recently did an exploration of how much evidence was out there for all the things that I'm talking about. I think I looked up 20 different therapies with this new AI app called Consensus that tells you the strength of the evidence for any therapy you ask about. You'll say, is so and so effective for whatever. So I put in acupuncture for chronic pain, opioids for chronic pain, energy healing for chronic pain, mind-body therapy for chronic pain. And believe it or not, energy healing way beat out opioids. So did everything else on my list that wasn't a pharmaceutical. Actually, I think even the other pharmaceuticals beat out opioids. So, anyway, it's not woo-woo. There's actually something to it. Again, I'm sure the practitioner makes a difference. Therapeutic touch in particular is used by nurses, and they don't even touch your body. They hover their hands over your body, and it's used by nurses to help patients when they're in pain, by nurses who are trained in it, and studies show that it's effective. Again, pharmaceutical companies don't like it, and they there's a lot of fake studies out there, where they design the study so that it will fail. They use untrained practitioners who don't know what they're doing. They just take someone off the street and say, hold your hands there, and there's more to it than that. So there is something to it. If you have the opportunity to try it, definitely cannot hurt. The worst that can happen is you won't get a result, and you may be shocked at the result that you get. Another treatment, it's actually a whole system of medicine that is maligned by conventional medicine, is homeopathy. Don't confuse this with herbal medicine, because that's not what it is. Homeopathy is a system of medicine developed in the late 1800s by a doctor in Germany. And the principles are like cures like is the first principle. So the idea is that if someone has a range of symptoms and they take a substance that in a healthy person would create those symptoms, that substance can have a healing effect on whatever the disorder is. But what this doctor did was he said, well, what if I make these substances weaker? What would happen? What if I dilute them so that they give the body a nudge, but not a strong one? And what he found was that the more he diluted the substance, and with each dilution, he would shake it, and then he would dilute it some more. And he discovered that the more he diluted it, the more effective it actually was. So in modern homeopathy, what conventional medicine says is there's not even a molecule left of the original substance. And what they dismiss is that the energy of the original substance is in the fluid, usually water or alcohol, that the substance was originally in. And there's now hundreds and hundreds of studies that show that homeopathy has an effect. And there are homeopathic remedies that relate to pain on a symptom relief basis. Arnica is a homeopathic remedy that reduces muscle soreness and bruising. Bruta reduces inflammation. Hypericum reduces nerve pain. But to truly experience homeopathy, if you go to a homeopathic practitioner, they will treat you as a whole person. They'll find out everything about you, every symptom you have, every inclination you have, every emotion you have. And then they'll come up with what they call constitutional remedy, which most closely fits you as a person and what you're going through. And that can be a very powerful kind of homeopathy, or even a tiny dose of something can put you on a better path. So it's pretty interesting medicine. And you can read more about all this stuff on the Alternative Pain Treatment Directory. There's almost 400 published articles on there right now about all of these therapies. So the next one is my favorite subject of all. Mind and spirit, the mind-body connection, are the most likely factors to be ignored in medicine, but are among the most powerful for healing. So I mentioned in my little advertisement for this webinar that I was going to tell you what the most powerful thing is for healing pain, according to the latest research, and that is the mind-body approach. So I'll talk a little bit about why. It has to do with a lot of different things. So one of the ways we know that, and I talked a little bit about this earlier, is the placebo effect. So if you give somebody a sugar pill and say, this will help your pain, or this will help whatever's going on with you, it will have an effect for the vast majority of people. Placebo effects account for about 60% of treatment effects. this is so well accepted that when a drug goes through approval, it usually has to be compared to a placebo. And it doesn't have to be a fake pill. It could be a fake treatment. Like if you were doing a placebo study of light therapy, it would be a light that wasn't in the right wavelength and strength and whatever to make a difference. But the person would know that because they'd see a red light. So if a drug or treatment is stronger than the placebo effect, that's proof that it works, according to modern research. And as I mentioned earlier, the more noxious the treatment, for instance, open heart surgery or back surgery, the greater the placebo effect is going to be, because your brain has to say it was worth going through all of that. It worked, right? So, some of the things that they use as treatments, they don't have even a 60% effect in terms of improvement. So you have to wonder, do they actually have a harmful effect? For instance, I mentioned earlier, gabapentin, it affects it. Only about 23% of the people say that it's effective. So if it was just a placebo effect, it would have a better effect than that. And then so many people say it hurt them. It caused intolerable side effects. So it actually does more harm than good from my reading of the literature, especially about placebo effects. Recent research has found that even if you say to a patient, we're just going to give you a placebo, research says placebos work. And they give people a fake pill and say, take it 3 times a day. For many people, that will work. And this particular product I have on the screen, when I first did prepare this presentation, the original one was a little while ago. They were selling this product on Amazon called Zeebo, and it's a fake pill. You buy it, you give it to, a family member who's who's got a cold or a headache, and you say, here, this will help. And chances are it will. It may not have, it may not completely eliminate the problem, but for many people, it will have a positive effect. And there are people in the medical community, in medical ethics, who say it's unethical to give people a placebo and tell them it will work. Well, in my mind, it's unethical to give people a dangerous pill when a placebo will work. So that's my 2 cents. See here. So stress plays a significant role in health and disease. I hope everybody already knows about it. This is a picture of a very frightened woman, obviously. So stress is about fear. The things that we stress about, we're stressing about them for a reason. You have a fight with a family member, they're going to leave you, they're going to abandon you, or they're going to make life difficult for you, or you have a fight with a boss or disagreement, you might fear losing your job. You're stressed about money, you fear not having the things that you need. So it's about fear. And our bodies have not adapted to modern life. In old times, when we didn't have all these modern conveniences and shelters and everything else, when we were in fear, it was because our body was literally in danger. There was a tiger chasing us or some other predator. And the body, when it experiences fear, prepares for fight or flight. So what it does is it increases muscle tension, it increases heart rate, respiration rate, blood pressure, inflammation. It decreases immune response, digestion, blood flow to the extremities, and healing and maintenance. And this is all adaptive. It decreases things it doesn't need right away because it wants to devote all of its energy to fighting or fleeing the threat. The increases are all about increasing what you need, more oxygen, more blood circulation, your muscles ready to go to outrun the threat. The blood flow to the extremities, they're not completely sure about, but they think it's because, well, they actually do know. I'm thinking of something else, which is skin moisture changes too, but I don't have that on here. Blood flow to the extremities does two things when you decrease it. It concentrates more circulation in the major organs and major muscle groups that you need to have the energy to fight or flee. And also less blood flow to the extremities. If you get injured, let's say a tiger lashes out at you and you have a big gash in your arm, you're less likely to bleed out if there's lower blood flow to your extremities. So all these changes that happen in the body are meant to last for a little while. And then when you're safe, your body's supposed to calm down. But what happens in chronic stress is that all of these stay elevated or decreased. And that has an impact on your health over the long term. Increased muscle tension is chronic pain, increased heart rate, can cause all kinds of problems, heart arrhythmias, respiration rate, blood pressure, inflammation. Decreased immune response is a big problem in terms of infections and cancer. Decreased digestion can cause all kinds of GI problems as well as just you're not getting the nutrients your body needs because you're not digesting food properly. Decreased blood flow to the extremities, that can increase your blood pressure long term. It's also Raynaud's syndrome. I run into people all the time who are diagnosed with Raynaud's syndrome, which is chronically cold hands and feet. And when I tell people that's stress, they're just amazed. They've never heard that. In fact, I had someone that I saw tonight, the parent of a child who's in therapy with me, and she mentioned she had Raynaud's and she'd never heard of that. You can tell how stressed someone is when you shake their hand and they've been inside for a while, not out in the cold. Their hands are cold, no matter how calm they look on the outside. They're probably stressed, at least in the moment, maybe not chronically. And decreased healing and maintenance. When you're trying to outrun a tiger, your body's not that worried about replacing cells that aged out or, healing a wound that you have or getting over an infection. It's trying to save your life in those few moments. But like I said, long term, that's a problem. If you've had childhood trauma, and I talked about some of what that could be, physical abuse, emotional neglect, sexual abuse, alcoholic parent, mentally ill parent. If you had childhood trauma, it leaves you, if you haven't processed it and treated it properly, leaves you in a state of chronic lifelong overarousal. And all those things that I just showed you, they're always, suboptimal in terms of your health. Now, a lot of people look at their childhood and they say, nothing that bad ever happened to me. Let me just say this first. This is a quote from Peter Levine, who developed one of the newer therapies for processing trauma. He says, trauma is perhaps the most avoided, ignored, belittled, denied, misunderstood, and untreated cause of human suffering. Most people, the tendency is just bury it, move on, try to have a life in spite of what happened. There's nothing wrong with that in principle, except that not dealing with the trauma has lifelong effects that are not good, not only for physical health, but mental health. So as I was starting to say earlier, trauma isn't just about big events like physical or sexual abuse or war or natural disasters. There's something called small t trauma. And this refers to emotionally distressing events that aren't necessarily life-threatening or catastrophic, but they have a significant psychological impact. like parental criticism, parents being physically present but emotionally unavailable. I have a client who, if she cried, her mother would make her go to her room. And she was telling me about this time she refused to go to her room. Her mother pushed her out of the door and locked her out because she couldn't tolerate her crying. So, parents could be there, they could put a roof over your head. This client came in initially saying, oh, my parents weren't that bad, I had a good childhood. But, can imagine that, and maybe you can because you've experienced it, that as a child you're upset, and instead of comforting you, the parent says, get away from me, which is basically what her mother was saying. Now, we don't know why her mother did that. Probably didn't mean to be horrible, but the impact on a child is profound. Overprotection is also traumatic. Bullying. I have a couple of clients right now who are bullied by their brothers. Their whole life they've been bullied by their brothers. They're males with older brothers who bully them. Like I said, dismissed emotions, like that client I was telling you about. Inconsistent parenting. You don't know what they expect. You don't know when something's okay or when it isn't. Those things can have really profound effects. I had a client once, she's actually an MD, and she was from Afghanistan. And she lived through the war in Afghanistan, the Taliban taking over. She lived through bullets going through the walls of her home. And fortunately, her family members were not in the path of the bullets. She lived through real physical danger and trauma. And what was she most traumatized by? Her mother's unending criticism. So it can be very, very damaging. It just affects your sense of self, your sense of your ability to navigate the world safely. This is another thing that's increasingly receiving attention, and this is one of the reasons that scientists are not now saying chronic pain is about the brain. And it's called central sensitization. And it's a neurological state where the nervous system becomes hypersensitive, amplifying pain signals and other sensory input, leading to heightened pain or pain from normally painless stimuli. So what happens, and this is where that CalMare therapy is useful, is it calms that signal from the brain that's no longer needed. The brain learns from experience. It's something called neuroplasticity. And what happens is if you're in chronic pain for a long time, regardless of what caused the pain, if you've had an injury that took a long time to heal, your brain, just becomes adapted to that. It's just like it's a pathway in your brain that the brain knows, and it keeps sending that signal even when the tissues are healed. The initial reason for that brain signal is your brain wants you to protect that area because it's injured. That's why it sends pain signals. Don't walk on that sprained ankle, that kind of thing. But after a while, it could just keep sending that signal even when that sprained ankle is healed. And that's central sensitization. It can be a body-wide situation like it happens in fibromyalgia. That's now considered central sensitization, where your brain is just saying danger, danger, danger. Your whole body is in danger. Protect your whole body. And as I said, the pain can be long gone. It can affect mood and fatigue. Fibromyalgia and chronic fatigue syndrome are now considered by people who know what they're talking about to be a central sensitization kind of situation. So there's many ways to reduce stress and resolve trauma. Relaxation, and I say not this kind because, flopping down in front of the TV is not necessarily relaxing. If you're like me, you're watching podcasts about, the chaos and turmoil going on in the country right now. Even if I'm sitting on the couch, that's not going to be relaxing. This is something that I had to learn myself when I was in chronic pain. I was literally sitting there, lying there in pain, trying to rest, watching the Holocaust miniseries, not understanding that that would have an impact on my physiology. So just the fact that you're sitting down, not moving, thinking you're chilling, that's not relaxation. Relaxation is a profound rest for the brain. So meditation is one kind of relaxation. What you're doing in meditation is you're fixing your mind on something that's neutral or positive. So it could be on your breathing, just watching your brain go in and out. One of the early books on the mind-body connection, I forget what the guy's name was or what the book was called, but it was basically all about, you got to relax, you got to free your mind, blah, blah, blah. It was a whole book. On the last page, he told you what to do. And it was watch your breath, and on the in-breath, say the word one. That was the whole technique. He could have done a one-pager on it, but he wrote a whole book. It was at Harvard. Howard Benson, maybe? Something like that. Anyway, there's different ways to do meditation. There's mindfulness meditation. Is a little different where you're watching your thoughts from a distance. You're just noticing them without judging them, without reacting to them. That's mindfulness meditation. Point of focus meditation, which people are more familiar with, most people, is where you could stare at a candle, you could watch your breath, you can repeat a phrase over and over again. Transcendental meditation, which was very popular back in the 70s. You're given your own individual mantra, which is a phrase that you repeat to yourself over and over again. And with meditation, nobody could stay on one track unless they've been doing it for a very long time. Every time your mind wanders, you just bring it back to what your point of focus is. So that's meditation. The more you practice it, the better you get at it. And that can be very calming. So this is something that's one of my favorite. I'm a certified biofeedback practitioner. It uses sensitive electronic instruments to measure your physiology. It can measure muscle tension, skin temperature, respiration rate, electrical activity of the brain. It feeds that information back to you in a form that you can understand so that you can learn to control your body. And this was the primary thing that helped me get better. As soon as I started doing biofeedback, my pain levels went down, excuse me, by 50% by the next day. And the first part that was so powerful was being told that I can get control of this. That if I changed what was in my mind, it would change what happened in my body, and that would help. It was the first time that anybody told me, I've been to all kinds of medical practitioners, the first time anybody told me I could have control over this. And I was given this thing, it doesn't even exist anymore. They don't make it anymore. But it was a strip that I wrapped around my finger, and it measured my hand temperature. As I mentioned earlier, reduced circulation to the extremities and cold hands indicate that you're in the stress response. So the idea was this was almost like a fancy more sophisticated mood ring. I don't know if any of you remember mood rings that change depending on, how happy or sad you were or whatever, how stressed you were. This actually had little boxes that would light up depending on, and they had numbers next to them indicating temperatures that would indicate how warm or cold your hands were. It was more sensitive than I could sense in my own body, but not nearly as sensitive as the clinical instruments that were available at the time, and even the one that I send my clients home with now. But I was able to practice relaxation techniques and see whether they worked or not. That's the power of it, because a lot of times people will, start meditating and they'll say, this isn't doing anything for me. And they'll give up because they're not that tuned into their bodies yet. And they can't really tell that there's a little shift in their stress level. And that's all you need to know to keep going. Um, so, um, so what you do is you're getting the information and it's telling you how you're doing with muscle tension biofeedback, which is called EMG biofeedback. You're putting electrodes on the tense muscle and you're experimenting with does changes in posture help? Does lowering, my shoulder help? Does deep breathing help? Does meditation help? What changes that? When I'm doing muscle tension with someone in chronic pain, I'll also have them show me how they hold their phone, how they hold the steering wheel, how they sit at their computer. So you can see when they're tensing their muscles and find less stressful ways to use their muscles when they're doing things. But even more important, making sure that when they're theoretically at rest, their body is actually at rest, their muscles are actually resting. So that can be very helpful. And respiration rate, there's one where you do measure respiration and heart rate. And if you sync them in a certain way at a certain rate of respiration, blood pressure goes down. So you could teach people to do that. The most complex one is neurofeedback, which is measuring the electrical activity of the brain. And that one, the brain is so complicated that you can't consciously, as effectively, alter your brain activity as you can if you just let your brain figure it out. So with neurofeedback, what you're doing is you're giving the person information, very simple information that says you're on the right track or you're not. And the way that the systems I use do it is we do it with audiovisual feedback in the form of DVDs. The DVD will play more smoothly, the screen will be bigger, the volume will be louder, the picture will be brighter if your brain's doing more of what we want it to do. And we can shape brain activity in terms of, hyperarousal of the brain, which has to do with that central sensitization that I talked about earlier. You can actually calm your brain so that it calms your body. And it doesn't matter if something started with physical injury. I had a guy come in and he was 12 years out from a workplace injury where a piece of very heavy equipment fell on him and crushed his back. And excuse me, it's my cold creeping up on me again. I need more of that PMF, common cold protocol. Anyway, so he came in and 12 years out after many back surgeries that were long in the past, he was still in chronic pain from his back. And we did 20 sessions of neurofeedback, just a brain calming, body calming protocol for his brain, where he watched movies with electrodes attached to his head, measuring his activity. It's not doing anything to your brain. It's just taking measurements and giving you information. In 20 sessions, he was paid free. So, it can be very powerful for pain. Fibromyalgia pains, CRPS pain, peripheral neuropathy pain. It can be very effective for that. in terms of that central sensitization. So cognitive behavioral therapy teaches patients to reduce negative thinking and increase positive thoughts for better stress management and pain reduction. Now, this is a cognitive level of change, and I think that it's very important. Some people are just worrywarts. They catastrophize about everything. You know, they experience a pain and they think, I'm going to end up in a wheelchair, I'm going to need back surgery, or, you know, and that kind of thinking. And it's often, you know, amplified when you go to an MD, you know, worst case scenario kinds of thinking, or just not even about the pain, just about daily life, just thinking worst case scenario for everything, worrying too much when there's really no need for it, worrying all day long when a little bit of worry will do fine. You know, when you really need to solve a problem, what I tell my clients is, you know, when you're actively working on solving the problem, that's when you think about it. If you're not doing that, think about something else, you know. So as I said earlier, your thoughts, or maybe I didn't say it earlier, I didn't say it enough. Your thoughts are what trigger your stress. It's not the external environment that's stressful, it's how you interpret that. And one example would be a dog's coming down the street. Now, if you love dogs, that's a pleasurable event. But if you're afraid of dogs because you had a bad experience with a dog, that's going to be a stressful event. It's the way you interpret that experience. And it's not just is it good or bad, it's also how good or bad is it? You know, because you can have a small problem and magnify it. You know, I'm on this website called Nextdoor, where patient neighbors, you know, post things to each other. And someone actually posted yesterday that it was so frustrating that when she threw her socks in the hamper, one landed on the floor, only one landed in the hamper. And the fact that this bothered her so much that she needed to post online just blew my mind. Don't sweat the small stuff. You know, there's a lot of small stuff that we don't need to stress about, that we stress about. And there's a lot of stuff that we stress way more than necessary, or we don't get the help that we need, you know, so it becomes more stressful because we don't reach out to people who can help us. You know, if you're in chronic pain and you try to do everything yourself, that you really shouldn't be doing because you need more rest, and you don't ask anybody else, you're making things more stressful. So, you know, how you think about things, how you go about solving your problems, that's important. And cognitive behavioral therapy teaches you better ways of doing that. It's not great for trauma resolution, but it is good for altering your thinking so that you don't trigger stress as much. So positive affirmations are one kind of cognitive behavioral therapy where you just, even if you don't believe it, you say, you know, positive things to yourself. Like every day in every way, I get better and better. That's my favorite one. I say that every day. I had a provider who said, that's impossible. That's not true. You know, you're aging, your body's deteriorating. Well, you know, still you could be getting better and better. You could still be getting stronger because you're exercising. You could be getting smarter because you're learning new things. You can turn ailments that you have around. So for me, it's true, you know, in you know, anything can get better. So that's one of them. If I'm going through something, you know, like I reminded myself in the middle of this cold, with every breath I take, I'm getting better and better. And that's true too, because your immune system is at work, you know, solving this problem that you have. So, or something hurts, I'll say, you know, every breath I take, or if I'm a lap swimmer, I'll say, with every stroke I take, my body feels better and better. You know, so that helps. It's reassuring thoughts that reduce stress and they improve outcomes, including your pain levels. I always tell my clients that if you're focusing on your pain, focus on it with a healing intention, not with fear. So, if you have a pain, the way you think about it is going to amplify it or make it better. So you can say, I have this shoulder pain. Oh my God, I have this shoulder pain. Am I going to be able to do what I have to do tomorrow? Or you could say, relax. Tell your muscle to relax because that's going to help. So there's lots of positive affirmations you can do. People do it for life circumstances too. They're going into a job interview. I'm going to walk out of there with this job. It affects the way you present yourself when you think that way. So it's something that can be helpful for pain. There's also visualization. And one of the places that this has been used more and more is with elite athletes. The Russians were beating the hell out of us in the Olympics for many years. And then we discovered that they were doing mental training. Their athletes were visualizing themselves performing, in an extraordinary way and winning the event. They didn't do any more physical training than we did, but they did this mental training. And now it's caught on. Elite athletes do this all the time. But it also helps people who are normal, who are not elite athletes, who just want to accomplish something, including healing. So visualizing, one visualization you can do for chronic pain is you visualize the area where the pain is and you notice its size, what color it feels like to you. If it were making a sound, what sound it would be making, what smell it would be emitting if it had a smell. And then gradually imagine it all shifting into something more pleasant and something smaller, so the size of it could shrink. It could turn from unhealthy black to pink. It can go from an annoying screeching sound to a nice little melody. And that can help reduce your pain. So, visualization is not just about seeing it. It can also be, bringing in all your senses, like I just did, hearing, visualization, visualizing, smelling, all of those. And there is research to back it up. Lots of books written about it too. And you can buy either digitally or CDs or whatever, or DVDs that have canned visualizations like, healing pain, better sleep, healing arthritis, things like that, where somebody can lead you through a guided visualization. This is another one of my favorites. I learned to do this in 2001. And I've been using it in my practice ever since. It's called energy psychology, and there's different techniques in it. But basically, what you're doing is you're bringing up the memory of something distressing. And when you do that, the emotions of that experience are available in the form of energy. You're bringing it up, and you can dissipate it by working with touching various energy points that are based on acupuncture meridians that have to do with different emotions. And when you do that, you can take something that's very stressful and traumatic and become calm about it. Excuse me. You don't have to, you're not going to forget something happened. Let's say you're dealing with a trauma from the past. You're not going to forget about it. You're not going to think it's okay. But when you think about it, it won't have the emotional charge anymore. And what happens is you tend to, if it's something where you keep thinking about it and you can't get it out of your mind, you've been having nightmares about it, you get triggered about it when something similar happens. This will get rid of all of that, even if it's been around for 50 years. So I've done this thousands of times with clients, probably done it hundreds of times with myself. It's very, very powerful therapy that I really think is the most powerful thing going for trauma and healing trauma. It also helps with phobias. And I'll give you an example because this was really, really powerful for me in terms of knowing that this works. So I saw this client. I had just been trained in 2001, and she came in because she had a fear of flying, and she wanted to. Oh, I'm going over time. I'm sorry. I'll finish up quickly. So she had a fear of flying. She wanted to go on vacation with her husband, and she was afraid to fly. So I used this technique with her. And at the end of the session, she said, I feel good. I feel like I can get on that plane and I'll be okay. And I said, just to make sure, how about coming back next week? And, we'll just make sure that you're really okay. So she did that. In the meantime, 9/11 happened. So she comes in the door and I said, how's your fear of flying now? And she said, it's okay. And I thought, wow, in the week that everybody else developed a fear of flying, she stayed, fear-free about her flying. So I thought this is good stuff. And I've used it in all kinds of circumstances, for all kinds of trauma, for all kinds of anticipatory anxiety. And it's a very powerful technique that now has hundreds of clinical trials that show that it works. And there are, I think it's the Green Cross and sometimes the International Rescue Committee. Groups like that go out and use it after natural disasters, after wars. They will use this with people to calm their nervous system down so they're not continuing to be traumatized. Okay. Exercise improves strength and flexibility, reduces muscle spasm and stiffness, corrects muscle imbalances, all of which reduce pain. I'll leave it at that for now. And faith. There's actually studies that show that even if a person doesn't know they're being prayed for, if they're prayed for, they do better than people who are not prayed for. People who have faith have better health and longevity. So if you have any tendency to be inclined that way, add it to your toolkit. So as I said, prayers of others have been shown to improve health as well as your own prayers. One of my biofeedback colleagues actually measured the effect of faith prayer 150 miles away by measuring people's muscle tension while they were being prayed for, and they didn't know they were being prayed for, and found that the muscle tension around the heart chakra, which is an energy concentration point near the heart, decreased by an average of 50% when people were being prayed for, even though they didn't know it. This should have been on the front page of every newspaper and was buried in some obscure journal. But it's real. So I guess my message to you is no matter how old you are, how long you've been in pain, how severe your pain is, or how poor your prognosis, there is hope. Never give up. And you can find out more about everything I'm talking about on the website, paintreatmentdirectory.com. There's a blog with much more information. There's providers. You can search them by location and by what services they offer. We have some absolutely amazing providers listed on the website. I don't have as many listed as I'd like, but there are some really good people out there, and I encourage you to check them out. Check out the products I talked about. There's a product section. If you buy something through my website, I might get a little bit of a commission, which helps support this work. So please do that. And then here's just a little more information where to email me, phone. And also, I did write a book. It was published 10 years ago. It's a pretty good overview. There's a few things I talked about that weren't in it because I didn't know about them yet, but it's a pretty good overview of the research, has inspiring stories of people who healed. It talks about why you haven't heard more about the treatments, or why the conventional medical community maligns them and the extent they've gone to malign them. But there's a lot of hope and information in that book. It's available on Amazon. I should mention also that I do offer a virtual consultation, a 90-minute consultation. You can email me if you're interested, where I go over in detail with you what's going on with you, what you've tried, what your condition is, what your resources are, and then I make recommendations that are very specific to your situation about what I think would help the most. And that's $150 for a 90-minute consultation. Well, thank you for coming, and feel free to reach out, send more comments, ask more questions. And I hope you all have a good night.